Hello everyone, hope you're all as happy as I am. It's the end of October and fall is here, my favorite season. I have yellow leaves glowing in front of me as I record this episode, and my maple tree in the back is finally turning its feisty shade of red. Today is Wednesday, October 28th, 2020. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Are you looking for more information on when you can compliantly use Modifier 25? Well, look no more. I dive into it in this episode. Welcome to Episode 8. This episode discusses the fraud uncovered in Operation Rubber Stamp, and where you can find my well-curated resources for Breast Cancer Awareness Month. I also deliver my trusty tips on compliant documentation for Modifier 25, and some illumination from India's most beloved non-violent activist, Mahatma Gandhi. If you've checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organization, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, go ahead and hit that subscribe button now so you don't miss an episode. Please write in a review and rating on Apple Podcast or wherever you listen to my podcast. I'd really love your support. Now, a quick disclaimer. Before I get started on the episode, this podcast episode and Nexsen Pruet podcast series do not constitute legal advice, but I am fortunate to work with sound healthcare attorneys at Nexsen Pruet. And as their consultant, I have over 10 years of experience in front office, back end, coding, and billing for multi-specialty physicians, compliance, and auditing for both E&M and surgical operative reports. Again, the opinions and insights throughout are mine alone, and they in no means constitute legal advice. So, let's get into Newsworthy. There have been major investigations in telemedicine fraud recently, with the latest being dubbed Operation Rubber Stamp. The others were similarly called Operation Brace Yourself and Operation Double Helix. These nationwide investigations involved telemarketing companies, genetic testing centers, owners of pharmacies, and owners of medical supply companies. Operation Rubber Stamp is the first ever billion-dollar fraud case in the Southern District of Georgia. At its core, this criminal network targeted by these investigations involves individuals and companies that collected patient data and sold it to one or more durable medical equipment, or DME, suppliers, pharmacies, or labs. Patients often were contacted by an international telemarketing network with the promises of often inappropriate DME, test results, and medications that often misled patients and delayed their chance to seek appropriate treatment for their genuine medical complaints. Defendant telemedicine executives allegedly paid doctors and nurse practitioners to order unnecessary DME, genetic, and other diagnostic testing and pain medications, either without any patient interactions at all or with only a brief telephone conversation with patients that they had never met nor seen before. DME companies, genetic testing labs, and pharmacies allegedly then purchased those orders in exchange for illegal kickbacks and bribes, and then submitted false and fraudulent claims to Medicare and other government payers. Charges include those against a former compliance officer for a company that allegedly facilitated more than $1 billion in fraudulent DME billings to the Medicare program, as well as other health benefit programs. Cases brought by the Southern District of Georgia's team included prosecutions of Georgia medical professionals, marketers, and telemedicine companies who caused millions of dollars in fraudulent claims to be billed. They included an indictment for conspiracy to commit wire and healthcare fraud by a Georgia nurse practitioner. There are also 5 counts of healthcare fraud, 5 counts of false statements related to healthcare, and 1 count of false statements. This nurse is also alleged to have facilitated orders for more than 3,000 orthotic braces that generated more than $3 million in fraudulent or excessive charges to Medicare. Now, the former compliance officer allegedly played a bigger role in the overall conspiracy, with conspiracy to commit healthcare fraud. As alleged in the information charge, the defendant and her employer provided access to an extensive digital platform that processed more than $1 billion in fraudulent or excessive orders for DME, billed to Medicare, Medicaid, and other payers. This most recent Operation Rubber Stamp, following earlier nationwide initiatives, like I mentioned, from the Department of Justice in 2019, Brace Yourself and Double Helix, brings prosecution totals up to 30 defendants now charged in the Southern District of Georgia. Across the nation, the most recent and guilty pleas in 19 judicial districts involving the submission of over $4.5 billion in false billings from fraudulent telemedicine schemes for 86 criminal defendants. Defendants include telemedicine executives, more than 24 licensed medical professionals, marketers, and the owners of DME companies, genetic testing laboratories, and pharmacies. Guilty pleas by more than 30 individuals will be entered or unsealed, including those by more than a dozen medical professionals. CMS, as well as the Center for Program Integrity, separately took the largest number of adverse administrative actions resulting from a single administrative healthcare fraud investigation initiative in history by revoking the Medicare billing privileges of over 250 additional medical professionals for their involvement in telemedicine schemes. Now, these next quotes from the U.S. attorneys involved in these cases show how serious they are about uncovering fraudulent activity. Quote, "Those who steal from federal healthcare programs are taking money from the pockets of taxpayers," end quote. Or when they say, quote, "Along with our federal law enforcement partners and our colleagues in the Southern District of Georgia, we have worked tirelessly to identify and prosecute those who seek to harm. We have also ensured that millions of dollars have been returned or will be returned to these essential healthcare programs," end quote. And there are also many messages from FBI agents involved who state, quote, "Thousands of Americans have had their health jeopardized and personal information bartered while these illegal enterprises have reaped our tax dollars," end quote. Or they also make such statements as, quote, "Fraudulent billing schemes cost every taxpayer and our healthcare system, and it targets programs like Medicare that assist the elderly and the poor. It potentially threatens their healthcare needs," end quote. So in my opinion, based on these recent investigations, there will likely be continued serious scrutiny on these areas of telemedicine, genetic testing labs, pharmacies, and DME companies to ensure those services are genuine based on patients' needs. Now, also newsworthy, I've devoted the entire month of October curating the best resources for you in breast cancer throughout our nation to raise awareness during Breast Cancer Awareness Month. Feel free to check out my many pink ribbon posts on LinkedIn this entire month, where I provide links to the best of the best in every region of the country. We are surrounded by the best clinical research teams from MD Anderson to Sloan Kettering to Northwestern to Johns Hopkins to Hutchinson, the Cleveland Clinic, the Mayo Clinic to Duke, and so many, many more. There is an experienced provider near you who can help guide you through a breast cancer diagnosis. And now, it's time for my best practice tips in Trusty Tip. I know there still continues to be widespread confusion and misunderstanding with how to use Modifier 25 correctly, to use it compliantly in the documentation I have seen over the years. Did you know it has been on the OIG work plans off and on since 2005? That's 15 years since they first came out with an educational piece titled Use of Modifier 25. Well, it really was the first random claims audit of 450 claims in calendar year 2002 using Modifier 25. Unfortunately, and upsetting as it is to me, I can and do agree and see that this continued confusion and misunderstanding can be considered abuse. So let me try and shine some light on how to be compliant with Modifier 25. First, it is categorized as a payment modifier. And by the brief definition in the very front of the CPT book, right behind the cover page, it states, quote, Modifier 25 is a significant, separately identifiable evaluation and management E&M service by the same physician on the same day of the procedure or other service, end quote. Now, that brief definition itself, in my opinion, is what causes so much confusion. You need to really know your CPT coding book. I'm looking at my shiny new CPT book for 2021. In Appendix A, it is titled Modifiers, and it discusses in much more detail. It states, quote, it may be necessary to indicate that on the day a procedure or service identified by a CPT code was performed, the patient's condition required a significant, separately identifiable E&M service above and beyond the other service provided, or above and beyond the usual preoperative and postoperative care associated with the procedure was performed, end quote. So that means that the medical documentation must show the provider performed extra work, extra E&M work above and beyond the usual work required for the other service or procedure on the same date. I always advise that your documentation for the E&M should stand apart from the other service or procedure. It should be able to stand alone as its own unique service. There should be medical necessity for both the E&M and the minor procedure or service. So that doesn't necessarily mean the diagnoses need to be different. The National Correct Coding Initiative, the NCCI, policy manual states this fact. But different does signify separate and distinct from the minor procedure or service. But do be mindful and remember that the diagnoses, different or not, must support what is in the medical documentation. Now, when you interpret the same physician requirement portion of the definition correctly, medical coders must remember that Medicare follows this rule found in Medicare Claims Processing Manual, Chapter 12, Section 30.6.5, that states physicians in the same group practice who are in the same specialty must bill and be paid as though they were a single physician. If more than one evaluation and management face-to-face service is provided on the same day to the same patient by the same physician, or more than one physician in the same specialty, in the same group, only one evaluation and management service may be reported unless that evaluation and management service is for unrelated problems. Instead of billing separately, the physicians should select a level representative of the combined visits and submit the appropriate code for that level. So, in a nutshell, for coding purposes, all physicians who bill under the same NPI number, even those sharing one in a group practice, are considered to be the same physician. Also remember, modifier 25 is only appended to the E&M code, not the separate minor procedure. And again, don't forget, that means it has a 0 or 10-day global period. Always review that NCCI manual when in doubt. Verify any and all edits at play before submitting modifier 25. I reread my NCCI manual at least once a year to stay fresh. Here's a pretty good example of when to use modifier 25 based on a scenario that's documented in the Medicare NCCI manual. It's in Chapter 1, Section D, and it's also located in the Medicare Claims Processing Manual, Chapter 12, Section 40.1.c. If a physician sees a new patient with a head trauma and decides the patient needs sutures, and after confirming allergy and immunization status, and after obtaining informed consent, the physician then performs the repair procedure. An E&M is not separately reportable in this scenario here, but if the physician performs a medically necessary full neurological workup exam for the head trauma patient, then reporting a separate E&M with modifier 25 appended may be appropriate. Remember, the decision to perform the minor surgery or procedure is included in the payment for the minor procedure, and it cannot be separately reportable, or the scenario above is not for the decision, and it does require a lot more significant workup, much more significant separate documentation too. By painting all the fine details of the medical picture, providers can begin to understand the correct and compliant use of modifier 25. And finally, this week's inspiring quote in Spark is from India and South Africa's Mahatma Gandhi. It is health that is real wealth and not pieces of gold and silver. An absolute in today's times, right? I think our health is the most important valuable we possess, and the COVID-19 pandemic has only underscored it, highlighted it exponentially. I hope we can all hold on to this philosophy and remember how this infectious disease has brought us all closer. So many have lost their jobs. The economy is not where it once was before the pandemic. Our collective material wealth has decreased significantly. But COVID-19 has forced us to be together, live in pods, so to speak, travel less to protect one another. We are collectively striving to make a difference, praying our latest vaccine developments will succeed. I am happy Mahatma Gandhi's spark still burns brightly in all of us today. So that wraps up today's episode. I'd love to hear your questions and comments. You can always direct message me on LinkedIn or voice message me on the Anchor app. And if you would like to inquire about my consultant services, you can always reach me through my email address at nexsenpruet.com. I'll leave links to everything in the show notes below. Please continue staying safe and healthy, practice safety for one and all during our collective life in the time of coronavirus. Hope you join me next Wednesday for episode 9 in the Paint the Medical Picture podcast series. Thank you for listening in on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday. If you want more information from me, go ahead and follow me on LinkedIn or send me an email at sonalpatel@nexsenpruet.com for all my consulting services in medical coding, auditing, and compliance. Thank you.